Have you heard of cardiac sarcoidosis? You may have heard sarcoidosis. It is a disease where inflammation causes clumps of cells called granulomas to form in various organs. Typically, it is found in the lungs or lymph nodes. It may make you feel tired or have trouble breathing or even cough. So what is cardiac sarcoidosis? Cardiac sarcoidosis occurs when the immune system forms the granulomas in the heart tissue, leading to inflammation. This condition often develops in individuals already diagnosed with sarcoidosis affecting other areas such as the lungs, skin, or eyes, but it can also occur in those who exhibit no prior symptoms of the disease. So how is it diagnosed? Diagnosing it can be challenging as it often mimics other heart conditions. A combination of clinical evaluation, medical history, and specific tests is essential. Key diagnosis methods usually include a clinical assessment, reviewing symptoms and medical history. 2, imaging tests. You may have heard of echocardiogram, which is an ultrasound of the heart to assess its structure and function. A cardiac MRI can provide detailed images of the heart tissue and detect inflammation. PET scan is an imaging technique that helps identify active areas of sarcoidosis in the heart. Electrocardiogram, also known as EKG or ECG, monitors electrical activity and can identify irregularities caused by cardiac involvement. This can be found in patients with heart block or fast heartbeats. Endomyocardial biopsy. In some cases, obtaining a tissue sample from the heart can confirm the presence of granulomas. So you may ask, what are these symptoms? Symptoms can vary among individuals, and some may not experience noticeable signs. However, common symptoms include fatigue, chest pain or discomfort, palpitations, which are irregular heartbeats. This can be too fast or too slow. Shortness of breath, swelling the legs, ankles, or feet, or passing out, which is known as syncope. You may have signs of heart failure symptoms. Because these symptoms can be vague or resemble other conditions, it is essential for patients to seek medical advice if they experience any trouble signs. So what other additional testing may be done? So in addition to the imaging, healthcare providers and doctors may check for other signs of inflammation in your blood. Each test contributes to a broader understanding of the disease impact of the heart and helps differentiate it from other cardiac issues. If you are diagnosed with cardiac sarcoidosis, the treatment options will depend on your severity and the presence of symptoms. Usually medications are steroids, so you may have heard prednisones, which is one of the corticosteroids. It is the first line of treatment to help inflammation and manage symptoms. Immunosuppressants are used in cases where prednisone itself does not help with the symptoms. Heart medications such as beta blockers or antiarrhythmic drugs may be used for heart rhythm management. In patients who have high risk of arrhythmias or sudden cardiac death, implantable cardiac or cardioverter defibrillator, or which is known ICD, may be implanted. Lifestyle modifications are important. Lifestyle changes such as maintaining a healthy diet, regular physical activity, avoiding smoking, and managing stress can support overall health. You may ask what natural remedies may help the symptoms. While medical treatment is crucial, some natural remedies and healthful adjustment may help manage symptoms of cardiac sarcoidosis. These can include anti-inflammatory diet, food rich in omega-3 fatty acid like fish, flax seeds, and walnuts. Antioxidants such as fruits and vegetables may help reduce inflammation. Regular exercise. Gentle exercise like walking, yoga, or swimming can improve overall cardiovascular health and reduce fatigue. Stress management is very important. Practices such as meditation, deep breathing, or Tai Chi can have positive effects on stress level and overall well-being. Adequate sleep is also important. Prioritizing restful sleep helps support the immune system and overall health. To summarize, cardiac sarcoidosis can be a challenging condition, but early diagnosis and appropriate management can significantly improve quality of life. Staying informed, recognizing symptoms, and working closely with your healthcare providers are essential steps for those affected. As research continues to advance understanding of this condition, a combination of medical treatment and natural remedies may offer help and relief for those living with cardiac sarcoidosis. If you find this information helpful, please like, subscribe, and share the video.